Sounds of Health will be live again at Hamden Fest on Saturday, June 14th at Hamden Town Center Park in Hamden, Connecticut. This will be the 20th annual Business and Community Expo with an artisan craft and civic fair, Friends of the Hamden Library book sale, Hamden Fest Half Marathon and 5K Road Fest, live music and entertainment, including us at Sounds of Health, and also a kids zone, sports zone, and food trucks. Please join us there, Saturday, June 14th. Thank you for listening to Sounds of Health. To help promote our podcast, please subscribe, rate, and leave a review on Apple Podcasts and Spotify, where you can find us by searching for Sounds of Health, and also on YouTube, where you can find us by searching Sounds of Health Podcast. We appreciate your support.
I have learned so much in this past year about myself that I had never thought I would do something like this or overcome that fear or keep pushing through the fear.
Right. Yeah.
And just keep pushing back. And I think that's an important lesson for anybody. Like running a marathon, scary. You're at the top of that hill and you're like, what am I doing? But just to push through and push back on the fear.
Yeah.
In life, in general.
Yeah. Hello, everyone, and welcome to Sounds of Health, where we uncover inspiring stories, highlight incredible people, and share valuable resources to help you boost your physical, emotional, and financial well-being. I'm your host, Dave MacNiven, and today I'm excited to welcome our guest, Dr. Kathy Papayani-Szabo, a trained physical therapist and owner of Body in Balance Physical Therapy and Wellness. Kathy, welcome to the show.
Thank you so much, Dave.
We're so happy to have you here, especially considering you're coming off of a marathon.
Yes.
So I don't even know how you're functioning right now.
Gingerly walking.
Yeah, right. It was yesterday?
It was Sunday.
It was
2
Sunday.
days ago.
This is, okay, right, okay.
Yep.
So that's amazing. Which marathon was this?
It was the Revel Mountain Series, which is a series where they run down mountains through national parks. This one was in the White Mountain National Park.
Wow.
So we ran down the Kankamangas Highway and then ended in North Conway, all downhill.
That's amazing.
2,300 about feet elevation.
Wow.
Down.
And what's the terrain like?
All road.
Yeah.
Road.
It's all road.
Card road.
Okay.
Yeah, card road.
But downhill.
Downhill.
Okay. Wow.
Yeah.
That can't be easy on your body.
No, not on your quads.
Wow. How much training did you have to do for that?
I did regular marathon training. I didn't really do a lot of downhill training, which I probably should have. That would have made my quads feel a little bit better.
Gotcha.
But yes, regular marathon training. You run, your longest run is 20.
Yeah.
You could do a little bit more. My longest run was 20.
Nice. That's great. Well, congratulations on that.
Thank you.
That's great. I know you brought the medal here.
I did.
You should probably hold it up for the camera. Because that
Here's
is
my golden medal. I'm very proud of.
that you should be. That is a great accomplishment.
Thank you.
I have
so
never
much.
done marathon distance, much less downhill. The most I've done is a half marathon distance and the Ragnar relay. Have you heard the Ragnar races?
Yep.
So that was I loved those events. Those were so much fun.
Those are fun. I have actually never done a Ragnar, but
yeah, definitely worth doing. The problem is the coordination of it all. Because
Yes.
it's
And you gotta
literally
find
two
people.
vans. Yeah. You need like 12 people in two vans and drivers. So that part's difficult, but if you have somebody who's good at that, then I would highly
Coordinating.
recommend it. Yeah.
Yeah.
Those are great events. Well, again, we're happy to have you here, and thank you so much for making the trek out as you're in recovery. We'd love to hear a little bit about you before we get into what it is that you do with your business and what you offer people. So tell us about your background. Where do you come from, and what brought you to what you're doing today?
So I'm from Long Island. That's where I grew up, born, raised, grew up. And as a child, I had scoliosis. So 11, 12 years old, I was diagnosed with scoliosis. So I feel that diagnosis really did lead me into my career choice because I had to wear a brace for 3 years. It was on for 23 hours. It was from my sternum to my hips, all the way around my back, came up to my above my shoulder
And what
blades.
ages were you?
I was 11 to 13.
Oh, wow.
Or maybe it was a 3-year period, so maybe 14. So they put me in that brace so that my curvature of my spine, which is what scoliosis is, wouldn't progress further than it or had already been progressed. So that was actually my first exposure to physical therapy, because after they put me in the brace, they were like, you need to learn exercises to do when you're out of the brace. You have 1 hour a day where you can be out of the brace. So go to physical therapy and learn what to do during that 1 hour. I took that extremely seriously as a child, which looking back now, I'm pretty impressed with myself. So I did take it seriously in that 1 hour that it was off. I did everything that the physical therapist told me to do, kept my muscles strong, because when you're in the brace, it would atrophy your muscles. So you need to exercise your muscles for that time period that I was out of it. So I was doing for that 1 hour, a lot of exercise. I would play, I was an athlete, so I played soccer and ran, and I would play soccer in that brace.
Oh, wow.
Yeah, I know.
I didn't know that was possible.
I know. So I would be out on the field with that brace and running right through it.
That's amazing.
So that I think really did, I didn't go into school. So I went to college in Connecticut. That's what brought me to Connecticut.
Okay.
At Fairfield University, and I was going for pre-med actually, because I was very interested in medicine.
Yeah.
So I think I had that medical, problem. So then it led me to medicine. I was very interested in medicine. But then during college, as I'm going through all the classes, which were great, but I was like, I don't know if this is really for me. And then I was exposed to physical therapy, and I was like, oh yeah, this is perfect. Like, I love to exercise. I'm a big proponent of exercise.
Right.
I do it on a daily basis. I play a lot of sports. So I was like, this is, and it still had the medical side.
Right.
So I can still do the medicine part of it.
Right.
But instill the values that I feel about exercise into other people as well.
So did you find physical therapy while you were at Fairfield University?
Yes.
And do they have a program?
They do not.
They don't. Okay.
So it was a 4-year bachelor's of science.
Okay.
And then you have to go to physical therapy school, which was 3 years. And
okay.
Yeah. And at the time it was a master's, but they were just changing over to doctorates. So I was probably like maybe 1, 2, or 3rd class of people who were getting their doctorates for physical therapy. So they had been turning it over to doctors, because I did have a choice.
Yeah.
I could have gone for a master's
or
a doctorate, but I went obviously get it done.
Yeah, right.
To the doctor.
Where did you go for that?
I went to Simmons College in Boston.
Okay.
Yep. And that's where I got my DPT. And from there, so I was going through my career, kind of changed jobs frequently, because I also in that time frame had gotten married, and my husband was very busy. He was also doing medicine. So I was kind of following his lead through the beginning of my career. So I was, working in some private outpatient, and then ended up moving to Colorado, which was pretty cool, to work in a private setting. And I was working with a lot of military, because my husband was in the military. So he was active duty at the Air Force Academy in Colorado Springs. Yeah. So that brought me there, and I was treating a lot of military members, which was pretty neat, pretty cool. Just trying to get them through injuries so that they can get back and they can get deployed. It was kind of like getting them back into action. So that was pretty cool. So then I started to focus a little bit more on orthopedics. Got an orthopedic specialty, took a little time off, had kids, and then was still we started to become into the corporate PT world, which is fine, has its place, but then realized there was a lot of gaps. I was seeing a lot of gaps and things I wasn't very happy with. The way people would come in, we would get them better. They had no place to exercise after. They had no place to do wellness. We weren't actually allowed to see them for wellness.
Oh, wow.
We just have to get them ready to get back to daily activities. What if they wanted to get back to running? What if they wanted to get back to, what if they had multiple body problems? Oh, no, we just got to see this.
Oh, wow.
So I was noticing the gaps.
Yeah. That had to be frustrating.
Very, very frustrating.
Yeah.
So that's where and I had always wanted to open my own business, like be my own.
Really?
Yeah, practitioner.
Yeah.
From like the get-go when I first got my degree. So then, but I didn't know how to do it. I was like, I don't know.
Nobody does.
I was like, I have no clue how to do this. I'm scared to death. No clue, business background, but I knew how I wanted to help people.
Yeah.
I knew how I wanted to help people, and I knew I could help people, but I could help them even better. And that's why I kind of opened my own business. There was a lot of factors in there. As a mom, you're kind of like scared. You're like, well, I have to, I'm a mom first, 100%. So how can I do this? Lots of thoughts and fears and doubts.
Yeah.
But it actually fell into my lap, which is like looking back on it pretty amazing, because I was working for corporate healthcare, and my manager came up to me and said, hey, there's someone that I know who lives near you who's looking for a PT to come to her house. She had a terrible accident, and she wants supplemental PT. So I said, okay. And I was in my mind, I had already set up my LLC, but I wasn't ready to launch it. It was set up, but I was like, nah. So I was kind of like, you know what? This is a sign.
Yeah.
This is definitely a sign. So, and this was kind of like, we were breaking out of the pandemic. So we were probably like a year into the pandemic.
Now you were in Connecticut by that
point.
Okay. Yeah, so you're in Connecticut at that point. Okay.
This is like, we came back to Connecticut in 2011.
Okay.
Yeah.
Gotcha.
So, I was like, all right, I'll sure, absolutely. I'll help her. And that's when I kind of got everything. I was like, oh, quick, let's get everything set up.
Yeah.
So I got everything kind of set up. I had already had the LLC, and it was like literally the most amazing experience. She was my only patient. And I went to her. So I started going to people's homes. Okay. That's how my business model started out.
Yep.
So I was going to her home, and so her insurance would only allow her a certain amount of visits, and she really wanted to. She was in a wheelchair. She really wanted to get out of the wheelchair. Very determined.
Yeah.
But she wasn't allowed the amount of visits that she needed to get the help to get herself there. So a year and a half later, she got out, with supplementing with me. At one point, the insurance had cut her off, so I was working with her one-on-one.
Okay.
And then she was able to get back in, which the combination of both therapies, phenomenal.
The fact you were able to maintain the treatment and the therapy.
She was able to go to very good therapy and then come home and work on it with me, and kind of was that combination was amazing. So it really did open my eyes. I was like, oh my goodness, look at this. Kudos to this person who sought it out herself and said, but look what you can do. Look at this.
Right, yeah.
I have to be able to provide this for people, provide this extra wellness that may not be covered by insurance, but is necessary to get yourself better and get yourself
right. Yeah, what a great validation of something you had already been thinking.
Right, exactly.
So it's telling you you're going in the right direction.
Right. So she's really inspired me. She actually just ran a half marathon.
Oh wow, that's so cool.
I'm actually gonna get teary-eyed.
Oh wow.
She 2 weeks ago.
From wheelchair to half marathon.
From a wheelchair.
That's amazing.
I know. So her personality is just phenomenal. That was, I was just there to witness it.
Yeah.
just accelerated. But so she kind of inspired me. Okay, you know what? I'm going to open. This is great. And then I was doing it on the side. So I had maybe one other patient where I was going to the home, and I was like, you know what? I think I want a storefront. You literally just jumped into this.
Yeah.
I'm totally blind. I was like, let me get the storefront. So I did, and at the same time, I was treating a lot of Parkinson's patients in my
your day job.
Yeah, my day job, and I really loved it, and I loved the population, and I was like, there's a lot of research in the literature about exercise, wellness, keeping exercise as medicine for Parkinson's, and I was like, you know what, I really want to start to do this. Because I love, this is great. These people need this. They need exercise as medicine. It complements their medicine. It keeps the disease from progressing.
Yeah, it improves quality of life.
Yep.
Yeah.
So I was like, I felt that calling as well.
Yeah.
So then I started to coach or personal train. I got my senior fitness specialty, and I started to personally train for a group who provides Parkinson's classes. called Beat Parkinson's Today. So
That's
then
awesome.
So I was doing that in the meantime while I was also treating on the side. And I was like, this is so great. Like maybe I could incorporate this into my practice and just kind of make it a wellness for people who have have other conditions.
Yeah.
With a PT who has the medical knowledge. So then I brought that into as an affiliate. I became an affiliate of that exercise program for Parkinson's.
Oh, wow. So it's like a certification and type of thing?
It's an affiliate, yeah.
Okay. The affiliation.
An
Okay.
affiliation.
Yeah.
And I'm able to do that. So I do that twice a week now. So I opened up last April and I incorporated that in. And then as well as treating people on the side for physical therapy and wellness, whatever sort of things they need. Like, hey, I did physical therapy, but guess what? I'm returning to the exercise classes and I still can't balance on my right leg. I don't know what it is. I still can't balance. Is it, should, and then I had the opportunity. Well, let's look at your hip. Let's look at your knee. Let's look at your back. Didn't have the opportunity to do that.
Okay. Yeah.
So, just really neat. Just different, neat, full body, whole body.
So how long have you been open as a business?
Well, I opened my LLC probably like 3 years ago, but then I opened the storefront about a year ago.
Okay. And where is the storefront?
It's in Guilford.
Okay.
Yeah.
That's amazing. Congratulations on all of that.
Thank you.
Yeah. I mean, what a story.
I know.
I had a conversation earlier today about relating to that plight of being ready and desiring to open a business and not necessarily knowing how to do it or where to go.
I still don't know.
And just jumping in. Yeah.
And knowing that you don't have to be perfect. Like, I went in being like, oh my God, I can't do this. I have to be perfect. I have to do this. I don't have what do I do? But and then I talked, you can't, it's not going to be perfect. You're going to learn. You're going to learn as you go. And I was very much like, oh my God, this is ridiculous. I was having that imposter syndrome.
I get it. Yeah.
I don't know what I'm doing. This is so crazy. But then you just kind of learn, and then people are appreciative of what you're doing, and that you're providing the class, and that you're providing them this care that maybe they couldn't have gotten somewhere else. And then you're like, oh, okay.
You get the validation.
Right.
Yeah.
But the fear is real.
Yes, the fear, especially when you have a family.
Oh my gosh.
So, I mean, I went through the same thing because I had, a family. I had 2 boys and they were young and they were playing sports and I was walking away from benefits and a salary, and it was a really scary thought.
Yes.
And it led to a couple of sleepless nights while I mulled it over.
Oh my goodness, me too.
Yeah, it's just in that fear. It kind of made me feel like I was moving in the right direction, though. That was ultimately what I decided. And I had never been afraid of taking chances before, but now when you have other people that are reliant on you, it is a little bit different.
Exactly.
Yeah.
Very different.
Yeah.
It is. But you learn a lot about yourself.
Yeah.
I have learned so much in this past year about myself that I had never thought I would do something like this or overcome that fear or keep pushing through the fear.
Right. Yeah.
And just keep pushing back. And I think that's an important lesson for anybody. Like running a marathon, scary. You're at the top of that hill and you're like, what am I doing? But just to push through and push back on the fear.
Yeah.
In life, in general.
Yeah. Well, and I feel like that is a good parallel with distance running, because distance running is all about being uncomfortable.
Oh, yeah.
And if you can't be uncomfortable, you're not going to get through the race. Most of it's mental.
Exactly.
And I do feel like that's kind of what running a business is too.
Exactly.
You need to constantly get out of your comfort zone.
Constantly.
Yeah.
Yeah.
And always be learning.
And trust the process and be consistent, but it doesn't have to be intense.
Yeah, that's true.
Especially as a mother of 3, I can't give you intense for my business. My business is not going to get intensity. It's not. I don't just have a certain amount of time and I'll do what I can and I'll slowly progress as I can. And I think having that mindset, that was hard for me too, I learned that probably a year in, I learned that.
Yeah. Yeah. That's actually pretty interesting. So you're saying you probably had a tendency of kind of going all at something. Right. And putting everything into it.
Not necessary.
No. Right.
And because you will feel it lacking in other parts of your life. And then you'll say, wait a minute, this is not why I did this. I did this to be available for people, but but I also need to be available in other places in my life. I can be multiple things at
So
once.
true. That's so true. I feel like years ago when I was working for other organizations, you'd always hear a lot about like work-life balance and having a balance between your work life and your personal life.
Yep.
Now, as a business owner, there's really no difference between my work and my personal life.
Right.
It's all one.
Right.
The cool thing about it is that I get to choose when I'm doing something. I'm probably
Exactly.
working harder than I've ever worked in my life,
Right.
but I get to choose when to do it so that I'm not missing out on that other side of life.
Right. Which
know?
is, I mean, amazing.
Yeah.
Priceless.
I mean, it's such a gift.
Yeah, it is a gift. It is, for sure.
Yeah. So that's really amazing. Now, is it just you in the business or do you have other people?
me.
Just you?
Yeah, for now.
Okay.
For now.
Yeah, that's great. And what are you offering? So what is it that you provide? I know we've talked a little bit about it, but
I have,
give me a little bit.
So I have the Parkinson's specialty.
Yeah.
I took, it's called Power Moves, which is a technique that you can use with Parkinson's. It's like big movements. So I've taken that certification. So I provide Power Moves therapy.
Yeah, I'm seeing that right now on your website.
Yep, for my Parkinson's patients. And then the exercise classes to kind of supplement, people can get their exercise in twice a week. So I do that twice a week. I do fall prevention. So I'm seeing, as you're working in your career, you're seeing people come in after an injury.
Of course.
Why
yeah.
can't we prevent this? Why
Yeah.
can't we do things? And exercise is the answer, really.
Yeah.
And I have the knowledge of the correct exercises or the right exercises you can do for that. And so fall prevention was another big thing for me. If you feel like you're losing your balance or you want to stay independent, you don't want to lose your balance, come in, let's do some sessions, let's work on your balance.
Yeah.
So that also I provide. And then orthopedics, because that is my background. I have a lot of experience in orthopedics. I do dry needling, a lot of hands-on care, soft tissue mobilization, joint mobilization.
And it looks like you have some group classes as well.
Oh, and then yes, I do a Saturday morning class, and that was that stemmed actually from a wonderful lady. This is amazing how people just come into your life, like all of a sudden you're just like, what, right?
Where'd you come from?
And it just opens these, like, this is amazing. And she's upstairs, she's a nutritionist, and she was like, hey, Kath, you think you can provide a class? Like, I can't get these people to exercise. Can you get them to exercise? And I was like, I'll try it. Let's do it.
To go along with her nutrition program?
Right. Well, yeah, they're coming up there to see her, and she's like, I'm trying to.
That's fantastic.
Yeah, amazing. So we do that on Saturday mornings, and some people did drop out, some people stay, and it's a great group. And it was an introduction to strength training, and now we just strength train together.
Wow,
it's a
that's
small
great.
Group. Yeah.
Yeah.
So super fun. So anyone looking to, I don't know where to start. I'm not comfortable at a gym.
Yeah.
I have a knee injury and I don't want to aggravate it. My back hurts. So every time I go to the classes, I'm hurting myself. Okay, well now I'm here. So I can watch you. I can say, oh, let's correct that. Let's do the proper form. So that's pretty neat. For people who really don't know where to start and just kind of get into a class. And so I teach that on Saturday mornings. Yeah.
That's great. And so are you serving all ages? And okay, so it's kind of open to anybody who is having issues. Now, where is the business coming from? Where are you finding people that are coming and finding you? Are they being referred?
So it's funny. I have a lot of them are coming from the Parkinson's.
Yes. Okay.
Yeah, and then I'm also a member at Orange Theory.
Oh, okay.
Yeah, and they've been, again, how people just come into your life, and they've been super sweet to me as well. So I've set up some tables there, stretching people, helping them through their, maybe they have some, hey, can I use the treadmill still? My knee hurts, blah, blah, kind of working through some issues there.
That's amazing. Okay.
I just kind of been trying to get in the community, and a lot of Parkinson's events I'll attend.
Gotcha. And do you accept insurance as well, or?
So I'm all cash based.
Okay.
Currently.
Yeah. So private pay.
Private
pay. Okay. Gotcha. All right. And what is your plan? Do you have
Don't ask me that. My plan is to just keep going.
Just keep going.
Yeah.
It's working so far.
It's working so
far. It's organic growth.
Yep.
Yeah.
It is, kind of take it as it is and grow as you can. And if you, put the energy in when you can. And I mean, I love what I'm doing right now. What I'm doing right now is just, I love it. I love the wellness aspect of it with the Parkinson's and the exercise classes. And
I'm sure it's really gratifying, and I can hear the excitement in your voice.
Yeah.
You're very passionate when it comes to what you're doing.
Yes.
And I know I've worked with that Parkinson's community in the past as well, and it's a great community. That is a awful disease, but it's something that people live with.
And I'm going to go back to mindset because that's where I've grown and learned so much from treating the woman in the wheelchair to I have another amazing story of my best friend who has multiple sclerosis, who just ran that marathon with me, has ran multiple marathons with multiple sclerosis, and she was a marathon runner, got the diagnosis, took some time off and said, you know what? I'm not going to let this beat me. Got on appropriate medication she needed and continued to do what she loved. Hiked, the 44,000 footers in New Hampshire.
Yeah.
Just changing my mindset of, look at that. Look at what you can do when you keep moving.
Right.
And then this Parkinson's community where you find out in the literature, exercise, if you keep up exercise, you can reduce symptoms or delay the progression. And it just really has opened my eyes.
Yeah.
I'm used to your knee hurts. All right, let's get you right. Let's go. All right, see you later. Yeah. Good luck. Right, yeah. Like, what are you going to do to continue your wellness? But look what you can do to continue your wellness, and look where it can take you, and look what you can get over, and look at your mindset, and you get these diagnoses, these terrible diagnoses, Parkinson's. But guess what you do? Yeah. You go twice a week, 3 times a week to exercise. You keep moving. Like, it's just blown me away in the past year, seeing that firsthand.
Absolutely. Yeah, it's amazing what people can overcome.
Right.
And there are solutions out there. It's actually what we love most about doing this podcast is hopefully what we're doing is we're highlighting and uncovering things that are out there for people.
Right.
Like your services. Yes. Because I'm sure there are many people who get a certain diagnosis or an injury. Pain can be debilitating for people. And it leads to a lot of people kind of turning off and going inward. And it's nice to have somebody that says, well, look, there's a way to get past this. Right. There are things that you can do to at least improve it.
Right.
And it's important to keep moving, as you were saying.
And keeping that positive mindset.
Yeah, very true. Yeah. Yeah. And it goes along too with, setting goals for yourself and working toward those goals and not giving up.
Yep.
And all of those things.
Yes. Yes.
Yeah.
And pushing back against fear.
Yes, pushing back against fear. That's going to be the theme of the episode, I think. Yes. Yeah. The more afraid you are.
It's true.
Just keep pushing back.
And I like what you said, how you said, when you're fearful, that means you are doing the right thing. I thought that's very powerful.
Yeah. I don't know if it's always the case.
I know.
But in that instance, yes, it definitely was.
I can reply to this.
Yeah, right.
But that's it, to look at it that way is just great.
Yeah. Well, we're lucky that we're able to do that.
Yeah. True. We are lucky.
Now, did you say your husband is a doctor as well? Okay. So what kind of medicine does he practice?
Anesthesiology.
Oh, okay.
Yeah. And he's in critical care. So more intense in the ICU units. Yeah.
Now, was he doing that in the military?
Yes.
He was?
No, I'm sorry.
Okay.
He was a flight doc.
Oh.
So he would clear pilots for flying. So he'd do their physicals.
That's awesome.
Or if they were coming off an injury, clear them. So that's what he did in the military. And then, but he was deployed to Afghanistan.
Oh, wow.
And that's where he saw a lot of critically ill people coming off the battlefield. And that really stimulated him to become, and I think he worked side by side by an anesthesiologist in Afghanistan. And that's where he got inspired to.
That's amazing.
I know, do critical care.
Yeah.
And just really help these people and be an anesthesiologist in critical care. Yeah,
important
I know
work.
I wouldn't be doing any of this without him. He really is my rock.
Yeah.
He's an amazing person. to do that type of work is you have to be
incredible.
Yeah. To be a certain type of person.
Right.
He's it.
Yeah, that's great.
Right. So yeah.
That's awesome. Well, this has been such a great conversation, and I'm looking at your website here, and I think it's just what you're offering and what you're providing to people is super important. What would you say is the time a person should reach out, and what is what would they do to do that, and then what does it look like when they do contact you?
So it's very personal. Like I want to keep it very personal. So I've had people just literally call me on the number there, and I've had half an hour conversations with people on the phone. Okay, you want to do something about this. You have this problem. Let's talk this out. Like, where's the best place? So sometimes it's not me. Sometimes it is something else.
Yeah.
But I just allow people to talk. So if you just say, hey, I've had this problem, I've gone to physical therapy, or I don't know if that's really going to help. Like, just call. And I'll sit there and we can chat it out and find out what's the best. Is it me? Is it something else? Is it,
and is it like an injury? Is it pain? What is it that should spark their interest in reaching out?
I would say you want to get back to something that you've always wanted to do, but you've had this injury or you've had this pre-diagnosis or, and you're like, I don't know if I can get back to that. Well, let's talk about it. Let's see. Maybe you can. Maybe there are options. Maybe we can work around it or do the right exercises to get you back to where. So my philosophy there and my logo is like, let's keep you active. You want to be active. Let's get you there. So if that's where your mind is at and that's where you're thinking, like, I really wish I could be doing this. I really wish I could get on the floor with my grandchild.
Yeah.
I really wish I could walk down the block with my dog, but I'm scared, or I don't know how to get there, or am I going to aggravate it? Let's talk about it and see if we can get you there.
That's awesome. It's so important. Yeah. Because there are ways for people to recover and strengthen and do more.
Yep.
And, it shouldn't be, a barrier to them.
Exactly.
Yeah. Great. Well, usually when we wrap up, I know you said you listened to the podcast, so you've probably heard this before, but we always ask our guests to leave our audience with a life hack that they incorporate into their daily health habits. So, and this can be really anything that helps people to live healthier physically, emotionally, or financially. Right. So is there a hack that you can share?
Oh, there's so many things, right? So many things. But I think one of the things I try to do, now don't get me wrong, this is very hard to do with 3 kids, in a busy lifestyle, is just notice the little things. Just like notice that your coffee smells really nice when you bring it right here in the morning, or notice, oh my God, that little flower came right, and say it out loud, look at it, notice it, just to let your mind kind of like relax and notice the beautiful things around you and keeping your mindset positive. And I think that's what I try to do.
Yeah.
Besides
you
exercise.
Practice that kind of, course. I think we can tell there's a lot of things you do to stay healthy.
But even just keeping your, noticing those little things and appreciating them and really being grateful for those little tiny things is very important. And
yeah, I like that, especially as people are busy. It is,
humbling.
And practicing appreciation, I think, helps everybody.
Definitely.
Yeah, put your mind into a different gear.
Yes.
Oh, great. Well, that is awesome. I want to thank you for taking the time to talk to us today and for being here on Sounds of Health. We're definitely going to encourage everybody to check out Body and Balance, located in Guilford, Connecticut, physical therapy and wellness. We just thank you so much for kind of joining us, and hopefully we'll have you back on the podcast at some point.
I'm very grateful for you. I think what you're doing is also amazing for small businesses and people like me trying to just give people the message.
Yeah.
So thank you. I really am grateful for you too.
Absolutely.
And Jason.
We appreciate you. Thank you so much. Okay, everyone out there, that's a wrap on another episode of Sounds of Health. As always, I'm your host, Dave MacNiven, and Sounds of Health is produced by Jason Carubia with music by Rob Hames. We're brought to you by Nutmeg Insurance Advisors, and we record at the offices of Nutmeg Advisory Group. Every week, we bring you stories that inspire, empower, and help you to upgrade your health. If you enjoy the show, please be sure to like, share, subscribe, do all those things. Leave us a review. Reach out. We love hearing from you, and we hope that you will continue to be an important part of our wellness community. Thank you so much. See you next time.